Now to our other big story tonight. Local leaders say hospitals across the state have little to no ICU beds, and COVID cases continue to rise in children. During a COVID briefing today, state health officials saying cases are 3 times higher among school-age children than they were this time last year. Utah's latest numbers show only 38.1% of Utah kids ages 12 to 17 are fully vaccinated against COVID-19. The rising cases comes as many students have returned to class.
We know kids are very unlikely to get seriously ill, but the sheer amount of transmission turns that small percentage into a fairly large number of hospitalizations.
The state now outlining cases at individual schools to track any spike in cases.
Well, the push to vaccinate stronger than ever before as our healthcare workers and hospital resources are being pushed to a breaking point. And with tomorrow being the start of September, you'll start hearing that message: get your flu shot on the regular.
Yeah, despite a record low number of flu cases last year, doctors believe this season will look a lot different based on the multiple viruses that are circulating and fewer people masking up. ABC4's Jillian Smuckler joining us live from Salt Lake City to explain why every bit of protection is needed to keep our hospitals running.
Yeah, Glenn, with flu season right around the corner, experts say now is the perfect time to head out to your local pharmacy, grocery store, doctor's office, just wherever you go to get your flu shot. And if you haven't gotten your COVID-19 vaccine, doctors encourage you to just knock them both out at the same time to save you the extra trip and to ultimately help them help you.
At this point in time, we're at a breaking point.
A crush of COVID patients is straining resources in hospitals across the state, with 485 hospitalized and an additional 186 in the ICU.
There's a real concern that, especially with the fact that our ICUs are full right now, influenza as it comes in could add to the problem.
According to the Utah Department of Health, when 85% capacity is reached, that means there's no more staffed ICU beds. We're at 87% of all ICU beds taken by COVID and non-COVID patients, overwhelming the system.
It's right now what we're dealing with is a different twindemic, which is respiratory syncytial virus and COVID.
Unlike last year, we're seeing multiple respiratory viruses circulating.
Now that we have changed our behavior, we're not masking, we're getting together again. Those viruses that are respiratory viruses, just like COVID, are spreading like crazy. And we expect that it's possible the same thing may happen with influenza.
Typically in December and January, Dr. Sheffield expects to see around 1,000 flu cases per week. But this year,
we had 0 cases of influenza. And it was primarily because we were doing the things that keep influenza from passing.
This includes social distancing, a record number of flu vaccinations, and people masking up.
If I could just have everyone mask up in the state, I would be such a happy person because I'd be seeing those zeros again of influenza cases.
While some believe this flu season will be harder to contain than last,
we had legislative changes that do not allow our health departments from a state standpoint to really tell people that they have to mask up.
Many are hoping high flu vaccination rates continue and translate into more people getting the COVID vaccine while they're at it. And I asked Dr. Sheffield if she expects the same people who are hesitant to get their COVID-19 vaccine to be on the fence about getting their flu shot. And she says she doesn't think people will be as concerned given the flu shot has been around for decades and most people know exactly what to expect when they get it. Reporting live in Salt Lake City, Jillian Smuckler, ABC4 News.